Hello, welcome everyone. We'll wait a few seconds for some people to come on before we get started. While we wait for others to join, we want to remind you of our exciting growth here at Barkman Smith. We plan to be ready to serve you in our new location in the next 2 to 3 weeks, located on Golden Triangle in the Alliance area of North Fort Worth. So stay tuned for our grand opening date announcement if you want to come and let us serve you north of the wall. This is going to be an amazing live stream. I'm excited you are all here joining us tonight. I believe some people are starting to tune in. If you're open to it, share with me how you became affiliated with Barkman Smith. Maybe you're a former patient or formerly worked for us as a tech. Just let us know in the comments below. Some other exciting news from Barkman Smith is that we will be adding occupational therapy to the services we offer you. We have a fantastic occupational therapist set to join us in the near future. We have an opportunity for you to meet her in one of our upcoming Facebook Live events. So check back here often for more updates. We'll also have a couple of episodes coming up of Get to Know Your Therapist. Our new OT, our new occupational therapist, will be on one of those. Also, Michael Merle, who will be heading to our Golden Triangle Clinic, our Alliance Clinic here in the next 2 to 3 weeks. So if you have any frustrations with this live stream, please direct all your questions and concerns to Michael Merle. And by the way, do me a quick favor, like this video. If you like some of the jokes, hit the haha button. If you find the topic I'm about to cover interesting, please consider sharing this live stream to your personal timeline. Your help is needed to reach others. So, if we're ready, let's do it. My name is Kollin Terrell. I'm a physical therapist here at Barkman Smith. I'm the clinical director here at the Bedford Clinic. This evening we'll be discussing the role of physical therapy in rotator cuff repair rehab. So, have you ever experienced any shoulder injury? What about shoulder surgery? What about rotator cuff repair surgery? Has anyone that you care about, have they gone through shoulder surgery? Have they gone through rotator cuff repair surgery? So if I'm sharing what relates to you, please consider commenting, sharing your story about your journey through shoulder rehab after surgery. I'd love to get your input on the subject. And let me know your thoughts, concerns, things that impacted your case, things that impacted your healing. And so in my 8 years of practice, I have discovered some key details to understand and consider when walking through rotator cuff repair rehab. In addition to the surgical technique, a major contributor to successful outcomes after rotator cuff repair is the post-operative management. What you do after you get your shoulder fixed matters. This is where physical therapy guides you to getting back to what you need to do and what you want to do. So first, you may ask, what is the rotator cuff? Well, there are 4 muscles that surround your shoulder joint. They help keep your shoulder stable by your side, and they also help with movements of your shoulder. So overall, every muscle in our body turns into a tendon, and that tendon attaches to a bone. So the same is true for your rotator cuff muscles. The rotator cuff muscles are really small. They surround your shoulder, and they're surrounded and covered on top by some big, meatier muscles. So if we have we have some rotator cuff muscles. We have one that turns your shoulder in. We have a couple that rotate your shoulder out. And last but not least, we have one that helps raise your arm to the side. Each of these muscles can be torn, but the supraspinatus muscle is the most commonly affected muscle. This is the muscle that helps raise your arm to the side. So each of these muscles can be operated on and repaired. But the supraspinatus muscle is the most often operated on. So let's talk about types of tears. We talked about the types of rotator cuff muscles, all 4 of them. Let's talk about the types of tears. There are several types of tears that can be identified via an MRI. So an MRI helps to show bones, muscles, joints, ligaments, soft tissues is what we call them. That's the fancy scientific term. An X-ray will show bones and joints, might show some swelling from time to time, But if we want to look at the tendons and the muscles, we need to have an MRI. So let's talk about some types of tears that might show up on your MRI. So I have my delicious bread here as an example of types of tears. So this French bread, this loaf of French bread, let's say it represents your muscle tendon complex. Let's say this is your rotator cuff muscle, and it turns into a tendon and attaches to a bone here. So you might see on an MRI report, you might hear the words a partial tear. What that might mean is you have a bit of muscle missing. So if you see on the MRI, it might say a partial tear. And so what that means is a piece has maybe come torn off the top. Now, I can't see all the way down through that bread, so it still has muscle and tendon intact around that tear. Now, you might hear something called a full thickness tear. What does that mean? Well, that means maybe the tear has gone all the way through down to the bone. So we have our rotator cuff muscle sitting on top of a bone, and the MRI can see all the way down through that muscle down to the bone. Now, you might also see there's still muscle intact. There's still muscle around that tear. See? Which isn't the worst news. You still have muscle intact. That muscle can still adapt and heal, and you still might have movement. Now, sometimes the MRI might show a complete rupture, a full tear, a complete rupture of that muscle and tendon complex. Now, if that happens, you might have a really difficult time raising your arm if any of those rotator cuff muscles are torn completely in half, if they've ruptured. So, how do these tears happen? So you might have a couple of different varieties of tears. There might be an acute tear. Acute just means something happened in the recent future that might have been traumatic. You might have fallen on it. You might have lifted a heavy object, lifted a ladder over your head, and you might have felt a rip or a tear. That's what we call an acute tear. There's also chronic tears. Those are tears that are a little much slower to develop. They take years over time to maybe show and take their time in tearing, and you might not feel it at first, but over time, your motion and your pain might be affected. So how you feel might be affected as those chronic tears degenerate over time. So now, let's say now you've decided with your orthopedic surgeon to go ahead and have the surgery to repair your rotator cuff muscle. What happens after your surgery? This is where physical therapy takes on the role of guiding you back to restoration of your shoulder. So let's talk about rehab phases. Let's talk about rehab phases after you've had a rotator cuff repair. So the first phase, this is where we want to protect the healing surgical site. So your doctor should tell you how they repaired the muscle, how they repaired it back to the bone, and they will let you know how rehab's going to go, how long it's going to take. So the first phase, this is where we want to protect that healing surgical site like we talked about. So this is the first 1 to 6 weeks after surgery. You might have a brace and a sling after you've had surgery. And so you might have that shoulder and that arm right to your side, and you might be in that brace for anywhere from about 6 to 8 weeks. This is where that first phase of therapy, this is where we work on what's called passive range of motion. So passive range of motion just means that the joint is moving, but you're not actively activating your muscles to do the work. Something is helping you through that motion. So I'm going to give you a little example on how passive range of motion works. So I'm going to invite a special guest over. None other than John Stoddard.
Hello, everybody.
You might know him. You might see him around the clinic.
Occasionally.
So let me move some of this bread out of the way.
Hey.
Go ahead and lie down here on your back for me, John. So this might be something your physical therapist does with you. Most likely in that first 6 weeks, even that first couple of days after surgery, if your surgeon wants you to come in for physical therapy that early, we're probably going to be working on these motions with you. So passive range of motion just means that I'm helping the joint move and John is totally relaxed and I'm moving his joint for him. So this isn't the most comfortable phase, and this is the phase where we try to teach our patients to relax completely. Sometimes we don't go through a lot of movement. Sometimes we just work on those first couple of sessions trying to get our patient to relax. It's tough to relax. It's not easy to relax. It takes practice to relax. So sometimes it takes time. When you totally relax, it's easier for me to go through the range of motion passively. It also feels better for John. John's not having to do work. When he starts doing work and tries to help me and is guarding, that's when it hurts a little bit more. So this is what passive range of motion is. I'm taking his arm, his shoulder joint through the motion without him actively having to activate his muscles to do the work. All right? Does that feel okay, John?
Perfect, I'm cured.
Okay, when's your next appointment?
Tomorrow morning, 6 o'clock. You'll be here, right?
Yeah, I'll be here at 5:30. First one here, last one to leave. That's me. So we'll also show you several activities you can do at home to go through passive range of motion. There are some ways that you can relax the joint and take it through some motion, get the nutrition and movement that it needs during this phase of healing. And we probably will work other joints too. Let's keep your elbows moving, keep your wrists moving, make sure those don't stiffen up. Because remember, you're probably going to be in that brace. And so when you come into therapy and we take that brace off, we're probably going to have to work through some elbow motion, some wrist motion, just because you've been stiff in that sling. The next phase, about week 6, week 8, we go through what's called active assistive range of motion. We can start that. And what that means is the joint is going through a motion. You're kind of helping it with your own muscles, but there's other things that help it. Sometimes we might grab a stick. If this is my shoulder surgery, I'm using the stick, I'm using my other hand to help raise it up. So I'm not actively doing all the work with my shoulder, my surgery shoulder. I'm using my other shoulder, my other arm to help me through those motions. So it might look like this. Let's say I had surgery on my right arm, on my right shoulder. I'm put this stick in my hand. I'll use my left hand to do all the work by raising it up. Now you're going to get a little bit of activation in your surgery shoulder, and that's okay. That's what we call active assistive range of motion. We also have things like pulleys that will help you through this motion. We'll put you in different positions to help you through some of those motions. Maybe you're lying down on your back with the stick. If you've had this surgery and you've come here for therapy, this stick, you probably had many, many encounters with it. And we may have shown you how to do it at home with maybe a cane or a broom, taking through several different motions. So then, after we work through passive range and active assistive range, we might start active range of motion. AROM is what you might see it labeled as. And that is you're actively using your muscles to do all the work. So I'm doing active range of motion right now. My right arm is doing all the work. The muscles are doing the work to move that shoulder joint. So phase 1 and 2, which we talked about, is maybe week 1 through week 12, is when you may experience the most discomfort. I have patients tell me during the first 6 weeks that their shoulder feels weird, their arm feels weird. It doesn't even feel like my arm, they say. There are usually 3 reasons why it hurts or feels weird. So the first reason, maybe you had a surgeon go in and there might be inflammation and irritation around the surgery site. So that might contribute to pain. The second reason is, we talked about you've been in that brace, that stiffness may have developed from being in that brace for the first several weeks. And so that might contribute to pain and that feeling weird. And the third reason is your strength hasn't quite caught back up. Now there's other reasons that might have an effect on pain, But that third one is a big one. Your strength hasn't quite caught back up. So you had a surgery there, which affects the muscle strength. You've had your arm in a sling and a brace. That affects your muscle strength as well. So then, after week 12, is when we typically start getting you into a strengthening phase. We might use things like bands. We might use things like dumbbells. We might just use gravity to work on strengthening your shoulder muscles. So then, your shoulder will start to feel normal. You'll get some restoration of your shoulder motion and your shoulder strength. Studies have found that the greatest improvement in strength occurs during the first 6 months after surgery. And so that's when this phase kicks in. These last few phases from week 16, week 12, all the way to week 52. And I say week 52 because restoration of your strength fully may not even happen for a year, which is okay. That's normal. That's what happens with a rotator cuff repair surgery. And at that point, you'll probably be feeling much better. You'll probably be feeling a lot different than when you had your surgery that first day. So, if anyone has any questions out there about rotator cuff repair rehab, what physical therapy looks like after you've had a rotator cuff repair, go ahead and give me some questions and we'll take a look. I'll do my best to answer them. So we've had one that says, someone asked me, what is the easiest way to re-injure your shoulder after a rotator cuff repair? That's a good question. The easiest way is something traumatic. You fall down and you tear your shoulder. Or you might start using your arm a little bit too early. We talked about your arm's going to be in that brace and that sling, most likely from week 6 to week 12. Now, you don't really want to be using your arm. Think of that shoulder, that surgery repair site, as wet cement. The only thing that's going to disrupt that wet cement is if you start using your arm, closing a car door, reaching out at the drive-thru to grab something, reaching up behind your back to scratch an itch. Those are ways that you might tear that muscle, re-injure it early on. You want to protect that repair site. And so moving your arm actively, doing things like that might cause a re-injury of that rotator cuff repair. So how soon after surgery does therapy usually begin? That's a good question. It's typically up to your surgeon. They have been inside your shoulder to see what type of tear you have, to see how big that tear is. And they may see a tear that's maybe small or medium, and you can start therapy a little bit earlier, maybe that first week. Those first couple of days after you've had a repair, you might be starting therapy. Sometimes if you've had a larger tear and they might have to do a little bit more work inside there, they may want you to wait a little bit. They may want that surgery site to heal and have a little bit of period of healing before they want you to start therapy. So I hope that answers your question. Someone asked which muscle is most often torn in our rotator cuff. And like we talked about, it's that supraspinatus muscle. Now, we talked about you can tear any of the 4 rotator cuff muscles, but the most often torn and the most often repaired is that supraspinatus muscle. Someone has a good question here. If I'm active, I'm a 40-year-old weightlifter, how do I avoid being a post-op surgical patient? Maybe means how do I prevent an injury from my rotator cuff? That's a great question. So, when we're doing weightlifting, a lot of times we focus on the big muscle groups, focus on the big meatier muscles. We do our bench press, we do our overhead press, we do our pull downs. We focus on those bigger meatier muscles, but sometimes we neglect some of the smaller muscles around our shoulder blade, some of the smaller muscles around our rotator cuff. You're probably not going to be using really heavy weights to train those muscles, but that's a good way to make sure you have good rotator cuff health if you are a weightlifter. Flexibility matters as well. So if you like to lift weights, I strongly suggest engaging in a flexibility program. If you've had shoulder pain from lifting weights, that's a good time to come maybe see us here at Barkman Smith. Why is it important to keep your exercise at home, or keep up your exercise at home, someone asked. Why is it important to do your home exercises, basically? Well, like we talked about, that surgery site has caused some inflammation, irritation. The brace has caused some stiffness. The only way that you can keep that stiffness from developing further, helping your shoulder feel better, is by moving that shoulder. Now, you might come here and see us once or twice a week for your therapy. That leaves 5 or 6 other days at home to where you need to make some gains. Let's get that shoulder moving. And so the best place to do that, the best place you're going to make those gains is at home. So I had one last question. Someone asked, if I have a rotator cuff tear, will physical therapy help prevent rotator cuff surgery? That is a great question. And the quick answer is yes and no. I think that physical therapy can help certain types of tears. It might even help a complete rupture. You might still have full movement, which I've seen before. Someone's had a complete rupture of the rotator cuff muscle, confirmed by an MRI, but they still have full motion. So not everyone that has a rotator cuff tear will need surgery. Physical therapy might help your muscles adapt, help get you back to what you need to do and what you want to do. And you might not have to have surgery. So I think that's all the questions we have. Thank you for joining us. Thank you for joining me. I would like to invite you to reach out to me if you have any questions about being a candidate for shoulder rehab. Feel free to comment below or give me a call here at our Bedford clinic during business hours. Our number here is 817-283-9435. Also, if you have any suggestions for topics you would like for us to cover, go ahead and put that in the comments section as well. Be sure to visit our website and our other social media platforms such as Instagram, Twitter, and YouTube. This video will also be uploaded to YouTube as well, so you can find our YouTube channel. Tune in to our next Facebook Live event in September as we continue our series on Get to Know Your Therapist. We'll be joined by Michael, as we talk about earlier. So talk again soon, everyone, and thank you for your time.